MFN 005 थेराप्यूटिक न्यूट्रिशन के इम्पोर्टेंट टॉपिक्स हैं ये। लिपोप्रोटीन in blood or complexes of protein. Role is to transport lipids within the blood. It is essential for proper distribution of cholesterol, triglycerides and other fats throughout the body. Type of lipoproteins: chymo, microns, VLDL, IDL, LDL or HDL. Gluten-free diet, uses and challenges. This is also important. Gluten-free diet is that diet in which gluten is excluded. Gluten protein found in barley, wheat, rye and other derivatives. Gluten-free diet essential for person with celiac disease, non-celiac gluten-free sensitivity and wheat allergy. Safe food for gluten-free diet is fruit, vegetables, meat and fish. Gluten-free grains, dairy products, legumes, nuts and seeds, gluten-free flours. Example: coconut, almond and chickpea. Chickpea and chana, Kabuli chana. Foods to be avoided in gluten-free patient: wheat, barley, rye, triticale, malt and their derivatives. Processed foods, sauce, soups, etc. are excluded. ग्लूटेन फ्री डाइट के हजार्ड्स क्या हैं? हजार्ड्स ऑफ ग्लूटेन फ्री डाइट्स: ब्लोटिंग ऑफ स्टमक, डायरिया, फटीग, long term complications, non surety for nutrition. ग्लूटेन फ्री डाइट जिनको लेनी है उनके लिए क्या क्या चैलेंजेस हो सकते हैं? क्रॉस कंटामिनेशन इन द किचन, लेबल रीडिंग एंड स्टेटमेंट, न्यूट्रिशनल बैलेंस. नाउ different modes and routes of feeding: oral feeding, in regular diet or modified diet, then enteral feeding, nasogastric tube through nose to stomach, nasointestinal tube, gastrointestinal tube या jejunostomy and J tube. Then perinatal feeding, PPN and TPN. Then supplemental feeding, assisted feeding by caregiver cognitive impaired patient. Then blended diets and homemade tube feeds. These may be given to the patients, and these are the different modes or the routes of feeding. Then classification of diabetes. टाइप 1 डायबिटीज़ ऑटो इम्यून कंडीशन में होती है. टाइप 2 मोस्ट कॉमन है. इंसुलिन रेजिस्टेंस एंड रिलेटेड इंसुलिन डिफिशियंसी. ये है फिजिकल इनएक्टिव पर्सन्स को होती है. देन जेस्टेशनल डायबिटीज़ ड्यूरिंग प्रेगनेंसी, restore after delivery, can be type 2 if not treated or cured. Then monogenic diabetes, caused by single gene mutation affecting insulin production. Then secondary diabetes result for other medical condition or treatment that impair insulin secretion in the action. So these are five type of diabetes we can say: type 1, type 2, gestational, monogenic, and then secondary diabetes. Now, nutritional management of anorexia nervosa. This is a critical component of the comprehensive treatment plan for this is a eating disorder. Main focus on restoring a healthy weight, correcting nutritional deficiencies, and then establishing normal eating patterns. These are some few topics: food elimination and adverse food reaction, drugs and nutritional status, then antioxidants and cancer prevention, diabetes and glycemic index, maple syrup disease and BCAA, weight status and percentile BMI for age. The nutritional management in GERD, we can say GERD, dietary management in burns, critical situation. Now, difference between food allergy and food intolerance. Food allergy is immune mediated, and food intolerance is a non-allergic hypersensitivity occur due to a number of reasons, and the reasons are metabolic reaction to enzyme due to physical reactions of food activities, and reaction to pharmacological agents in food poisoning, also food poisoning. And the causes of food allergy. Food allergy is a complex process within a few hours, can affect various parts of our body from mouth to finally lungs. And immunoglobulins produced by plasma cells and response to antigen, these are the factors. Then symptoms of food allergy: itchy tongue and mouth, skin rashes, air obstruction, asthma in lungs, and eczema. These are the symptoms of food allergy. And food intolerance. Example of food intolerance are lactose intolerance and gluten enteropathy. Gluten enteropathy जिसमें गेहूं से एलर्जी, हम आम शब्द में, आम भाषा में इसको गेहूं से एलर्जी बोलते हैं, और इंग्लिश में इसको मेडिकल टर्म्स में ग्लूटन एंटेरोपैथी बोलते हैं, कॉल्ड ग्लूटन एंटेरोपैथी. Next important topic is difference between clear liquid diet and full liquid diet. First difference between food allergy and food intolerance. Second, between clear liquid diet and full liquid diet. Then external nutrition and parenteral nutrition. Now, this topic is also important: acute infection and chronic infection. Acute infection are the infections that develop rapidly and typically have a short duration. They are often caused by bacteria, virus, fungi, or other parasites. Symptoms of acute infections are fever, cough, sore throat, muscle aches, fatigue, and runny nose. And treatment of acute infection is medications such as antibiotics, antifungal, or antivirals depending on causative agent. Then chronic infection, these are long lasting infections caused by pathogens that persist in the body for extended periods, often months to years. Cause of chronic infections are bacteria, fungi, virus, parasites. These lead health complications. And the example of chronic infection are HIV AIDS, hepatitis B and C, tuberculosis, fungal infections. Example of fungal infection, candidiasis. Then treatment of chronic infection is medication to control pathogens growth and boost the immune system. By boosting our immune system, we can recover from chronic infections. Then attention, if you suspect an acute infection, to receive an accurate diagnosis and appropriate treatment. The next important topic, primary hypertension and secondary hypertension. Difference between primary and secondary hypertension. Now, difference between again food allergy and food intolerance. Food allergens are immune mediated as they involve the generation of antibodies, which are immunoglobulins produced by plasma cells in response to an antigen, which is an allergen. Immunoglobulin has been identified in the role of allergy in humans. Example, airway obstruction, asthma in lungs, GI symptoms, vomiting, diarrhea, and vomiting causing food are walnut, peanut, milk, fish, and shellfish. Shellfish is also a kind of fish. Then food intolerance. It is non-immune mediated. It is a non-allergic hypersensitivity which can occur due to a number of reasons. Compared with allergy, which is involved in the reaction of food item or allergen with the body's immune system. So these are some common differences, some differences between food allergy and food intolerance. Now, here are some other questions. The next question is dietitian's role. The dietitian's role in any hospital or in any field, the role of dietitian is clinical services, public health, community nutrition, food services, nutrition information and communication, then wellness and disease prevention, then nutrition research, then cardiovascular fitness, prenatal nutrition, sports nutrition, helping professionals. So multifarious roles of dietitians. Dietitians as administrative dietitians or clinical dietitians, research dietitians, community dietitians, consultant dietitian, teaching and academic dietitians. So there are many kind of dietitians in many fields. Then here are a number of questions and topics for exam. These are some important topics. Medical nutrition therapy for burn, and role of antioxidant in cancer prevention, then complications of diabetes, then diet therapy for gout and maple syrup urine disease, then role of fiber and fluids in diarrhea and constipation, then uh, some common kind of food you include in your diet. Comment on these foods. Then 4 diagnostic tests for kidney disease, nutritional management of peptic ulcer or hepatitis coma, then feeding and nutritional management of dysphagia, then important question, dietary management during dialysis, some short notes on feeding, nutritional requirements and dietary management of ulcerative colitis. So these are some important topics. Any 5 effects of drug on food intake, absorption, metabolism or excretion. So write any 5 effects of drug on food, absorption, metabolism and excretion. And this is systematic logical approach, relations between patient, client, group and dietetics professional. So nutritional assessment, then nutritional diagnosis, then nutritional intervention and then nutritional monitoring and evaluation. So these are the 4 steps: assessment, nutritional assessment, nutritional diagnosis, nutritional intervention and monitoring and evaluation. These are the 4 steps in this systematic logical approach. And the abbreviation BEE. BEE, basal energy expenditure. B for basal, E for energy and E for expenditure. So now I am with some liver diagnostic tests. The first is albumin test, then lactate dehydrogenase test. The third one is total bilirubin and direct bilirubin test, alkaline transferase test and alkaline aminotransferase test. ये पांचों टेस्ट लीवर की बीमारी को डायग्नोस करने के लिए ये पांचों टेस्ट कराए जाते हैं: एल्ब्यूमिन टेस्ट, लैक्टेट डिहाइड्रोजिनेज टेस्ट, टोटल बिलिरुबिन एंड डायरेक्ट बिलिरुबिन टेस्ट, then alkaline transferase test, then alanine aminotransferase test. और जैसा कि मैंने आपको बताया था, डायबिटीज़ भी 5 प्रकार की होती है, जिसको हम नॉर्मली भाषा में नॉर्मल लोग बोलते हैं शुगर हो गया है, इसको मेडिकल टर्म्स में हम डायबिटीज़ बोलते हैं। तो देर आर 5 टाइप्स ऑफ डायबिटीज़: IDDM, NIDDM, MRDM, IGT एंड जेस्टेशनल। तो आज के लिए इतना ही, कल फिर MSc DFSM का चैप्टर लेकर आएंगे। धन्यवाद।